All right, let's talk about deflection programs being created for the recriminalization of hard drugs in Oregon. It's going to happen on September 1st. Yesterday, we told you that Multnomah County's deflection center will not open in September, instead aiming for mid to maybe late October. Also last night, we shared Washington County's plan with a walkthrough on the process from the district attorney, Kevin Barton there. Following our story, we heard from several of you who feel like viewers John and Pat. They wrote, Washington and Clackamas County seem to be able to discuss, decide, and implement like adults. I wish we were confident that Multco's continued excuses and lack of action did more than delay and waste funds. We welcome any progress, but we are finding it hard to feel supportive. Hope is not a strategy for success. And how about this from Dawn? I was struck by the preparation in Washington County and that the DA gave us all the details. I did not hear any tone of politics. It seems that in Multnomah County, it is always the county chair saying this or that. The stark contrast here is a county that wants to get something done versus one that is mired in politics. Thanks for your comments. Well, today, Multnomah County commissioners were briefed on the latest version of deflection here in Portland. And much like DA Barton's walkthrough of that deflection and the scenario and what it's going to look like in Washington County, well, Multnomah County commissioners got a similar report. Remember, someone is eligible for deflection only if they have no active warrants out for them, nothing else, and the only crime that they're committing is possession of a soon-to-be illegal drug like fentanyl, whether they're actively using it or not. Now, here's a leader in the county health department explaining how it's going to work.
Once there's the law enforcement encounter and an individual chooses deflection, law enforcement will call the center. That's when the intake process will begin. So we'll get basic information that we'll need, both to be able to start intaking the client as well as meet the reporting needs we have for CJC, et cetera. So once they call, they'll transport the individual to the center. When law enforcement arrives, a peer will meet law enforcement at the door and there'll be a warm handoff to the peer. And it's important to note that the peer will stay with the individual throughout this entire process in the center. So once the individual comes into the center, we'll finish doing intake quickly. Next, they'll go into some standardized screenings. The first of those screenings will be done by a nurse, and it'll be a medical screening to ensure that the individual doesn't have urgent medical needs. If at that point it is determined that the individual does have urgent medical needs, we will transport them out of the facility via EMS services. Assuming that they pass the medical screening and they're safe to stay in the facility, then they would continue with some mental health, substance use disorder, as well as basic needs screenings. So at that point, they would move on to develop a customized care plan in partnership with, the care coordinators / case managers and the peer. At that point, there will obviously be a number of referrals and needs that the individual may have. The team will determine which one of the referrals that we want to track as far as successful deflection. I think it's important to note that we want to track the single referral that will result in successful deflection, but we also want to make referrals, to the other needs that they have. And so at that point, the next step would be supporting the individual via transportation to, if there's an available service that they need, to that service. If there isn't that available service at that moment in time, then we would take them to where they requested to go. We can't. Individuals will have. Everybody will have the option to take transportation. We can't. Force people to take transportation for not a better way of saying it, but we definitely want to support individuals in that way. And what we've heard from a lot of folks is that we're assuming that most individuals would want to be transported from the facility. So after they leave the facility, the peer, will continue to interact with that individual. We'll track if they've actually completed that service. Again, there's that 30-day window that they have to complete the referral. We also anticipate that we would continue to engage with, individuals past that 30-day time frame.
All right, so not a quick explanation, but it is the clearest example yet that we've been given on what it's all going to look like. Now, the final plan on deflection for Multnomah County will be shared with commissioners and hopefully the public this Friday, and we'll be watching. And before we leave the story, we also wanted to touch on the deflection center's delayed opening again, because numbers shared with us this morning show that the center was nowhere near ready to open in a week and a half, as kind of we all were led to believe. And after getting a look at these, you may be wondering if October is even feasible. Let's start with this table showing the staff needed from the company to the county has hired to run the deflection center. The company is named Turk House. Look at the top left there where it shows the staff type. Then to the right of that, it shows how many people would be needed if the place was going to open around the clock 7 days a week, which is not going to happen anytime soon. The next column is one shift only number. Well, that represents the minimum staffing needed to open for daytime only services. Okay, so let's focus on that. So they need 2 piers to open, and they've hired 1 who started today. Intake staff is covered for now with 2 folks hired. Care coordinators, 2 are needed. 1 is hired and 1 offer is outstanding. They need 2 nurses to open. Again, only 1 has been hired and 1 offer is out. And no program director has been brought in yet as well. And check out the column showing how long it will take to train someone after they are hired. Well, it shows it's between 2 weeks and 1 month. And during today's briefing, it was pointed out that training cannot even start until those people can get into the building itself. And that may not happen until late next week because it's still being renovated. I'm not laughing because I think it's funny. I just think it's outrageous. And here's the county side of things for hiring. Someone in Chair Vega Peterson's office is working as the deflection coordinator until a real coordinator is hired. Otherwise, not a single person has been hired. 0. You can see on the right side that the health department will cover positions until people are hired apparently. No word on when their 2 weeks of training will begin. So, yeah, this thing had like no shot of opening on September 1st. Will mid to late October even be possible? I guess we're gonna have to wait and see. Keep it right here. We're back right after this.